Hello, everyone. So 50%, almost half of people in the United States have high blood pressure, also known as hypertension. And that is a blood pressure of 130/80 or higher. So of the 50% of people, almost 50%, it's 47% of people, but of the 47% of people in the US that have high blood pressure, only 26% of them have it under control. And many of you know that having high blood pressure can put you at risk for many health conditions. So the thing though is that things like heart disease and stroke, which is one of the risks of having high blood pressure, used to be rare and is still rare in many other countries, but was rare in the United States prior to World War I. So what has changed? Well, before we go any further, welcome to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a primary care physician and owner of InTouch Primary Care in Sugar Land, Texas, and I am so excited that you're here. We do this every Wednesday at 2:15. This is a good place to be if you desire to take charge of your health and do all you can to live a healthy lifestyle. Remember that you can watch this episode and all our other episodes on YouTube, on our InTouch Primary Care YouTube channel. Please share, subscribe, and like our videos, and hopefully you can get it to people that really need to hear this. Okay, so let's talk about high blood pressure and why it matters. So as I mentioned, high blood pressure, also known as hypertension, is when blood is pushing against the walls of your arteries because the pressure is high. So our arteries carry blood from our heart to the rest of our organs. And when we have high blood pressure, let's talk about what's happening in the body. So the high blood pressure system damages the arteries throughout the body. And so it's causing the vessels, the arteries to be weak, or it causes the arteries to form clots in them. And so if you can imagine, if those vessels are damaged, they can't effectively carry blood to organs. And so it puts a strain on the organs or damages parts of the organs. So very, very important that our blood pressure is lowered in that case. So why do we care? So what if our organs are damaged? Well, you know that there are very critical organs that are damaged, unfortunately. So it increases the risk of heart disease, kidney disease, eye disease, strokes, and even if high blood pressure doesn't lead to death, it causes significant suffering and disability. So it has also been associated with dementia. So particularly people that have uncontrolled high blood pressure between the ages of 44 to 66, there's been an association with developing dementia in later life. So there are many reasons to not ignore the blood pressure. Okay, so how do you know? Say you're like, okay, how do I know if I have high blood pressure? The first thing is you have to check. There is really no other way. 1 in 3 people that have high blood pressure don't even know it. And that contributes to not being able to control it. So the more, as people get older, it's more common, obviously, but even young people can have high blood pressure. I've seen children with high blood pressure. I've seen teenagers with high blood pressure. Obviously, as you get into your 20s, 30s, 40s, it gets more common. But even young people can have high blood pressure. So it is important that you check. And you may have noticed if you walk into any health facility, most of the time they're going to check your blood pressure because it is so common. Okay, so who gets high blood pressure? Well, generally speaking, there are many things, there are several things, the combination of things that can cause people to be more at risk for it. So genetics obviously plays a role. Lifestyle definitely plays a role. The environment plays a role. So there are several things that can contribute to high blood pressure. But again, it is such a common condition that it is so important that everyone should be getting screened for it. Okay, so what can I do? What can I do? I have high blood pressure. What can I do? So normal blood pressure is 120/80 or less, right? So we start to categorize people as high blood pressure when it's 130/80 or higher. So between that 120 and 130, we say your blood pressure is elevated, but you may not be diagnosed as high blood pressure. But regardless, if you have been diagnosed, the first thing I want to encourage is don't ignore it. Okay, it's one of those things that need to be checked regularly. How often you check will depend on whether it's controlled or not, how high it was in the first place, what your personal risks are for developing heart disease and kidney failure and all that stuff. But at the minimum, most people should be checking monthly and ideally for 1 week every month. So, and usually twice a day for 1 week every month, just to make sure that it's fine. But that's not, that also depends again on several things. It might be a lot more for many people. Okay. And it's important that you check the home readings. So some people are under the false impression that you should be checking, the blood pressure is only accurate when it's done in the doctor's office. But actually, home readings are a more accurate predictor of organ damage than the clinic readings. So your home values are so important. Okay, so it's important to check them at home so that we can know in your natural environment what your blood pressure is, because those are found to be more associated with target organ damage. So you should get an automated blood pressure machine. What I do is I have my patients bring their machine to the office so that we can compare readings of my machine with their machine. We confirm that they have a good machine that is working well. And then I want to be able to, I have them fill out a blood pressure log so we can keep track of their blood pressure. And over time, we can confirm that their blood pressure is controlled. Okay. And before we get into any more about what all else you can do, I want to talk about proper technique because it's so important. I'm sure you've had your blood pressure taken in many places. I know I have, where I know the blood pressure is completely inaccurate because of how it was taken. So as I mentioned earlier, it's good to get an automated device. And then the second thing is make sure that the cuff goes on your upper arm, not your wrist. So those wrist blood pressure machines, I would recommend doing the one that goes on your upper arm, okay? And then don't just sit down and check your blood pressure right away. You have to wait about 5 minutes. And there are several other things. Ideally, you shouldn't have just been exercising, or you shouldn't have just had some caffeine or smoked cigarettes or even alcohol. So there are several things that can affect your blood pressure. So it's important that you are checking when you are, or even taking a bath. So you want to wait about 30 minutes after to check your blood pressure. And then once you do that, you want to make sure that you are seated and rested for about 5 minutes, okay? And then you want to make sure you're rested with you're seated and with your back rested against something or against the wall or the back of the chair. And then your arm needs to be at heart level. And then your feet need to be planted on the ground, okay? And then you're resting for about 5 minutes and you check your blood pressure. Then you wait another 2 minutes and check it again. So that's how to make sure that you're getting an accurate blood pressure. Don't just sit down and check it. And so that's really important. So sometimes people come into the office and we check their blood pressure and it's high. And I actually prefer not to check their blood pressure until they've been sitting for a while, because it doesn't give me a good picture until they've really rested. But so that's important, that you're actually getting an accurate blood pressure. And then the last thing that I see that is so common is that people are not using the right size cuff, right? So I have a blood pressure machine here. You can't see it, but every blood pressure machine should let you know what's the range of the cuff that you should use. So for example, the one I have here is a home blood pressure machine, and it tells me that the cuff size fits arms 9 to 17 inches, which is 22 to 42 centimeters. So your upper arm can be measured with a tape measure, and you can find out how big or small your arm is, and that should determine what cuff size you're using. Because if the cuff is too small, your blood pressure is going to be inaccurately high. And if the cuff is too big, your blood pressure is going to be inaccurately low. So it's not okay to just use any size cuff. You want to make sure that the machine you have has the right size cuff so that you are getting an accurate blood pressure. All right. So one other thing I'll throw in there is that some people, that are already taking blood pressure medicine think, if they need to do lab work or something like that, they shouldn't take their medicine, or if they're coming to see their doctor for the first time, they should hold their medicine before coming in. Don't do that. There usually is never a reason to hold your blood pressure medicine, even if you've not eaten. Most of the time, except your doctor tells you otherwise, go ahead and take your blood pressure medicine as usual. Because when you come in, that's what we're trying to find out, what your blood pressure is on your typical schedule, not what it is off your typical schedule. So that's just, something that came to mind that I wanted to mention. Okay, so what can you do practically when you have high blood pressure? So you may have heard of several things, weight loss, limiting alcohol and caffeine, avoiding tobacco use, reducing stress, increasing exercise. And these are very important things to lower blood pressure. But I'm going to be discussing this more in detail in my upcoming webinar, which is October 22nd at 12 p.m. So we'll put the registration link for that. But for today, I want to focus on what you can eat, because of all the lifestyle changes that you can make for health. I feel like nutrition gives you the greatest bang for your buck. So I spoke earlier that in the past, before World War I in the United States, that high blood pressure was actually, heart disease was pretty rare, and strokes. So what changed? Well, what changed is we started eating processed foods. So our nutrition is very important. As we've moved towards processed and ultra-processed foods, we've also seen that things like heart disease and cancers and many other chronic conditions have continued to rise in the Western world. So we can make some significant changes to improve blood pressure by changing how we eat. So one of the things we can do is move towards more of a whole food plant-based diet, which means eating more vegetables, especially dark leafy vegetables. So there was a study done that showed that when they increased the amount of plant-based foods in a population of people, within 1 week, their blood pressure already started to lower just by removing meat, fish, poultry, and eggs from their diet and really increasing dark leafy vegetables. So that's one of the biggest things that can be helpful. Not everybody can completely do all of that, like remove, meat, fish, eggs, and dairy, but a lot of us can at least increase our dark leafy green vegetable intake, which is very important, because dark green leafy vegetables have been lower the sodium to potassium ratio, which has also been associated with lowering blood pressure. So as much as you can increase your greens when you have high blood pressure, go ahead and do it. Even a change towards just eating more greens and avoiding a lot of the meats, fish, dairy, and eggs can have a great effect. Just do the best you can, but move towards more of a plant-based diet. The second thing that you can do is eat foods that are high in potassium. So it's been shown that 3,500 to 5,000 milligrams per day of potassium from food, ideally, can reduce your blood pressure approximately by 4 points. So eating more potassium, just making it a daily habit, can be helpful. And so calcium and magnesium have also been shown to improve blood pressure. So you can get these from dark green leafy vegetables, also from legumes, like, all kinds of beans and berries. So people that have high blood pressure, taking lots of berries can be helpful as well. So there are other specific foods that have been associated with lower blood pressure. There isn't great evidence for these foods, but it's worth mentioning because it doesn't hurt, right? So the studies were not, there's some flaws in the studies, but there have been, it shows that it can help lower blood pressure. So it's worth it. So foods like flaxseed, taking 1 tablespoon daily of flaxseed, celery, hibiscus tea, garlic. These are specific foods that have been associated with a lower blood pressure. So it's worth, looking into those. And of course, limiting sodium. So this one is special because I know a lot of us know about sodium in terms of its relationship with blood pressure. And the ideal amount of sodium a day for people that have high blood pressure is 1,500 milligrams or lower, which is 3/4 of a teaspoon of salt a whole day. Okay. And sodium is tricky because it hides. So there are some things that don't taste salty, but have a lot of sodium, for example, bread. Also, if you're eating out a lot, then more than likely you're getting a lot of sodium in your diet. Or if you're eating a lot of canned foods or processed foods, you can get a lot of sodium in your diet. So foods like packaged foods, bread, rolls, pizza, sandwiches, cold cuts, cured meats, soups, canned goods, savory snacks, those are things that, you can be taking a lot more sodium, and really limiting sodium can be very effective in lowering blood pressure. So if you have high blood pressure, your plate might look like this. You could have a variety of greens, especially dark leafy vegetables, and then fruits, especially berries. That can be half of your plate. And then you can have whole grains, so brown rice, whole oats, whole bread. You want to check on the salt content on that. And then you can have the other quarter of your plate filled with legumes, so chickpeas or black beans, green beans, lima beans, that sort of thing. But you also, if they're canned, you want to make sure that you check in the sodium content. So one thing I want to stress when it comes to high blood pressure. So I know a lot of times people want to avoid taking medication, but it's important to know that whatever you're doing, you need to do it with a doctor. Okay, so if you're on high blood pressure medication, don't attempt to just add different things and not follow up with your doctor, because low blood pressure can be an issue too. So if you do it too well and your blood pressure is not your blood pressure medications are not adjusted, then it could be too low, and that's a problem. Or the other part is when people feel like, oh, I don't want to take medicine anymore, and they just stop. And so now their blood pressure is high, but they are doing lifestyle changes, but they're not checking. That can be very dangerous too. So it's not something you want to just try to do on your own. At the end of the day, the goal is to lower your blood pressure. Your organs don't know, well, they do know the difference if it's with food because it feels better. But the point is, if your blood pressure is high, even if you're making lifestyle changes, it can affect your organs. So the goal is to lower your blood pressure. So don't just stop your medicines without discussing with your doctor. Make sure that you have a doctor looking over this with you and helping you with this process. And if you're in the Houston area and you're looking for a doctor that is proactive about your health, then come check us out at InTouch Primary Care. We do things differently. Our practice is set up so that we can spend time with our patients, talk through all those things that I'm talking about today, and so that our patients can reach us easily so they don't have to delay their care. And we can see you even if you don't have health insurance. So we operate under a membership model. So it's like a gym membership, like a subscription practice. And that gives you access to all our services. So don't ignore your health. If you have high blood pressure or you need a primary care doctor, come check us out if you're in the Houston area. All right. So imagine if, you've decided to make some dietary changes. You start incorporating lots of vegetables and fruits and berries. Green leafy vegetables, legumes. You've reduced the salt in your diet. Guess what? Not only will your blood pressure get lower, You probably will also lose weight. You will feel a lot better. Your mood will improve. Anxiety will reduce. And then you're lowering your risk of several very, very serious health conditions, including heart disease, stroke, eye disease, kidney failure, and dementia. So it's worth it, to feel better, have more energy, mental clarity, save time and money. There's so many, many, many advantages. So if you know someone that has high blood pressure, please share this with them, okay? Well, my name is Dr. Ashaye, and look forward to seeing you again next week on Connecting the Dots with Dr. Ashaye. Have a great day.